So the recent news is good. We are on the other side of the plateau and the numbers are coming down. But that's good news only compared to the terrible news that we were living with, which is that constant increase. And remember, you still have 1,300 people who walked into the hospitals yesterday testing positive. So it's no time to get cocky, and it's no time to get arrogant, right? We still have a long way to go and a lot of work to do. And this virus has been ahead of us every step of the way. We have been playing catch up from day one in this situation. So it is no time to relax. And this is only halftime in this entire situation. We showed that we can control the beast. And when you close down, you can actually slow that infection rate. But it's only halftime. We still have to make sure that we keep that beast under control, we keep that infection rate down, we keep that hospitalization rate down, as we now all get very eager to get on with life and move on. So it's not over. And we have a whole second phase. And in this second phase, first, do no harm. Don't jeopardize what you've already accomplished by seeing that infection rate increase. We have to be smarter, especially when it comes to the new frontier of testing and how we test and how aggressively and how we get that organized. And then when we talk about rebuilding, we have to talk about not just rebuilding, but let's learn from this horrific experience. And let's take these lessons forward, and how do we build back better than before? I don't want to have gone all through this and then just say we're reopening. No, no, no. We have to open for a better future than we have ever had. And we have to learn from this. And as we go through this, remember, I know people are eager to get on with life. We have slowed the infection rate down to 0.9%. 0.9% means one person infects 0.9% of a person, less than one. That means the virus is slowing. If one person is infecting 1.2 people, the virus is increasing and is an epidemic and an outbreak and is out of control. So we have a very small margin of error here as we navigate going forward. Any plan that is going to start to reopen the economy has to be based on data, and that means it has to be based on testing. And this is a new world for all of us, testing. How do you get testing up to scale? How do you get it up to scale quickly? And how do you find out where we really are right now in terms of this virus? You have all these scientists and all these experts who are basically trying to extrapolate from the data, but we don't really know. How many people were infected? How many people had coronavirus but self-resolved? We don't really know because we haven't been able to do testing on that large a scale. But we're going to start here in the state of New York with antibody testing. Antibody testing means you test a person to find out if they have the antibodies which they would have if they were infected with the coronavirus. And we're going to do that in the most aggressive way in the nation, where we're going to sample people in the state, thousands of people in the state, across the state, to find out if they had the antibodies. That will tell us, for the first time, what % of the population actually has had the coronavirus and is now, at least short-term, immune to the virus. This will be the first true snapshot of what we're really dealing with. And we're going to be doing that over the next week in the New York State Department of Health. Will be running that. There's also another set of tests which are called diagnostic testing. Diagnostic testing is whether a person is positive or negative. And we're coming up to scale on this, even though it is very, very hard. Northwell is leading the parade on this, and I just looked at some of the technology they're bringing in. All these different manufacturers who made different machines to run different tests. and there's a number of big manufacturers, and Northwell is bringing in as many as they can. But this has to be brought to scale. Nobody has done testing at this level ever. And we have to do this in partnership with the federal government, because there's all sorts of logistical questions and supply chain questions, and people can't get certain chemicals they need to do tests, and the chemicals are made in other countries. So we have to do this with the federal government. I spoke to the head of the CDC yesterday, and he was very smart and very informed, and we talked about how we can do this together.